there, Caroline Dixon here with Neuronutrition Associates. Wanted to touch base with you on folate receptor antibodies and the use of a medication called Leucovorin, which is high-dose folinic acid, also known as vitamin B9. At Neuronutrition Associates, we have used Leucovorin for about 10 years. We utilize a test called a Folate Receptor Antibody Test, or FRAT for short. So patients with autism spectrum disorder are more likely to have a folate receptor antibody. And what that means is you have a receptor in the brain allowing folate or folinic acid across the blood-brain barrier. And when you have a folate receptor autoantibody, it's either binding or blocking to that receptor and not allowing that folate across the blood-brain barrier. Folate is the precursor to our neurotransmitters in the brain, things like dopamine and serotonin. So if the brain is not getting enough folate across, we can often see things like anxiety, depression, neuropsychiatric symptoms. And so what we do is give high-dose folinic acid, or Leucovorin, and it uses a receptor called the reduced folate carrier, which I call the back door. It's kind of the back way in to get folate across the blood-brain barrier. It's not only in kids or adults with autism. It can also be in neurotypical patients. Sometimes we'll see, chronic anxiety or chronic depression that's, we just can't put our finger on the root cause of it. And this is sometimes a big piece of the puzzle. So we'll see improvements in those symptoms with patients who are not on the autism spectrum, but those that are on the spectrum, we can see an increase in cognition, an improvement in behavior, and also can see some verbal expressive language. I've also had patients who have a tremendous increase in just expressive language alone, maybe not necessarily verbal, but engaging in play with siblings and communicating in other ways with parents that they haven't been doing before. So if you are curious about this, please reach out. This is a medication that we are very familiar with and have prescribed for a long time very safely. It requires some nuance and starting at a low level and tapering up. If you think about a brain that's not getting much folate and then all of a sudden it's kind of being flooded with folate, that can create some excitatory or anxiety symptoms, irritability, some increase in stimming in those on the autism spectrum. So it's something that we like to take very slowly and methodically with patients until we get to the goal dose. Thanks so much.